Us in studio. I haven't seen you in a while. Sandy Middleton with us here this morning. How are you?
Good to see you.
Sandy is the executive director of the Center for Violence Prevention. And you brought a fellow Dorito fan with you.
Absolutely.
I just found that out right before we went on the air. Beth McCord, nurse practitioner, and a sexual assault nurse examiner. How are you?
I'm good.
Glad to have you here.
And also a Mountain Dew fan. So usually she has her Doritos and her Mountain Dews.
Yeah.
Look.
Really?
Look. So I'm a little upset about the fridge in there.
Where were you at the last meeting last month? The club got together and I didn't see you there.
Well,
so
I didn't get my notice.
We got to have a conversation about that. Now, you guys, this is never an easy topic to discuss, but as you know, those are the ones I think we need to talk the most about because nobody really wants to
For sure.
talk about it. But
Right.
It has to be talked, and that's how we get results. So let's start off once again, and I got into this yesterday when we were having our law enforcement roundtable. There are still plenty of people that you mentioned the human trafficking problem in Mississippi, and they go, the what?
Right.
That doesn't exist. That's a big city problem. That's nothing to do with us. No, it's everything to do with us,
Yes,
isn't it?
Absolutely. Well, and the Sound of Freedom movie that's so popular, that was an example of something that happens in a third world country where the kidnapping and everything happens from there, but that's not usually what we see here. And so it's really important for people to not only be aware of the issue, but also to really understand what it is and what it's not. So the whole awareness issue, and SuperTalk's so great. Y'all have been so great to help us inform the public and legislators about what it is and why it's so important.
Well, and you talking about people not realizing what it is, and it's not like, the movie. Because, correct me if I'm wrong here, Sandy, a lot of the cases, a lot of the things that we see that we deal with here in America and here in Mississippi involve a family member.
Yes, there's family connections. Sometimes mom needs money for drugs, or mom needs to pay the light bill. I mean, let's face it; these are hard times, and so they turn to that 12-year-old daughter and pimp them out, and that's trafficking. So, and then we see the gangs. We see the gang involvement. So many times, girls don't ever have the opportunity to be in any kind of leadership with a gang. I mean, they're the drug mules and they trade sex for whatever, and that's trafficking as well. So we've got a lot of problems, and I've got some great stats that are brand new from this year through the Center's Tower program and our rapid response across the state. Just January through March this year, we've seen 97 victims and offered 1,407 services. Second quarter, we saw 63 victims and offered 1,584 services. Quarter three, so far, 27 victims with 778 services. So from this calendar year just to now, we've seen 187 victims.
Wow.
So, and it's all over the state. It can be in really small areas, or it can be in our metro areas. And so, but the good thing is, we always have to talk about the good part too, because
Yes.
we've done such a great job at the Capitol. I mean, the leadership has been wonderful to help us update our laws, and then we've got all these certified investigators now, thanks to the AG's team over at the Attorney General's office, and then we've got all our rapid responders on the ground. So there's just been a huge effort, and also funding. I mean, the legislative appropriation has been helpful as well. So we've got a lot to be happy about as well.
Yeah, exactly. And those stats, and I was talking to you, and I don't know, I haven't seen the recent ones. I went to double check just a minute ago. But the last stats that I saw were from August of last year, 2022, and Mississippi was number one per capita out of all 50 states in human trafficking cases.
Well, and I think we're starting to recognize it, and really our legislation and the things that we're doing with our rapid responders all over the state, it's pretty, we're a model for how we're responding, especially emergently. And, if you can see the victim and contact, have that immediate contact with the victim and offer them all these services immediately, then law enforcement can go do their jobs And then, so it really is working beautifully across the state.
Well, and Beth, let me ask you this, because, we've talked about this before. This is a very challenging situation, whether it's a sexual assault, whether it's human trafficking, which oftentimes go together,
Right.
admittedly. That's an uphill battle to build trust with them, isn't it?
It is. It's a very tough situation when you're trying to build that rapport. You get maybe 5 seconds in that very beginning to build that rapport, and if you don't, it's an uphill battle then, and they're less likely to trust you and to really know that you're there to really help them. So it's sometimes very tough to do that.
And to be fair, they haven't had a lot of people that were there to help them.
That's
in their
exactly
life.
right. I mean, they've had law enforcement, they've had other advocates, they've had medical people say, hey, I'm going to help you, and then in turn exploit them sometimes. So it's very hard to show them. And actually you have to show them. You have to say, hey, I'm going to help you. I'm going to provide these services, but then show them that you can do that. And so many times we've been able to do that. We provide them the service, and then maybe they need a little extra. And instead of just saying, hey, you need to go follow up here, we'll actually take them to the hospital, take them and get that extra, whether it's extra medication that we don't have on hand or something like that. And that it does so much for them. It shows that people really do care.
And that's the most beautiful dance. I wish people could see what happens at these operations when, our brave, courageous law enforcement, strap up and go out and find these victims and, and arrest the bad guys. And I mean, it's really an amazing experience to watch these ops. And then, the investigators bring the victims in, and they're so grateful to be able to offer something to the victims. And they love having Beth there because she's a nurse practitioner. She's a sane, she can test them for, different kinds of infections and treat them and everything. And so then it gives you a place to go from there instead of just taking them to jail or taking them to detention or something. So I wish everybody could see the magic that happens at these ops. They're really special.
And it puts another light on law enforcement, because a lot of times with the girls, they may have a bad rap, but or with the victims, I'll say women or men, but then it helps to say, hey, I told you I was going to take you to get some help. There's the help. I'm here to help you.
Let me ask you this question. When you're dealing with a victim that has been brought in, it may take a couple of minutes, it may take hours, it may take days. I would suspect you can see when the light comes on in their eyes.
Oh, sure.
During the process.
Mm-hmm. A lot of times when we're doing their just initial talking to them, and coming with that trauma-informed care where there's no judgment, a lot of times I see they're trying to tell me the worst thing because they want to elicit a response from me. And when I don't give it to them, they're like, oh, okay, this girl is good, because I'm not going to judge them. You can tell me the worst thing, and some of that comes from my ER experience. So I probably already heard it or seen it. So you can't spook me. You can't really, get me sideways. So, that's a beautiful thing.
ER nurse, you're used to people walking in with their foot in a bag, and you go, have a seat over there, fill out your paperwork. We'll be with you in a minute.
Your turn's coming.
Don't worry, we got a mop. We can clean that up after we get you back. We got to get some paperwork.
We actually hand them a towel and say, you need to clean your mess up.
Oh, even better. It's better than I thought. That's fantastic. But that to me, I think, would be one of the most rewarding things about it is you have someone, and here's the thing that you have to realize. You talking about them not being, really, in a lot of cases, responsible for what they've had to do. They've been forced. And in a lot of cases, that happened because they had someone that they placed their trust in.
Right.
And then they took that trust and used it to use them for whatever purpose. And that's just a very quick downward spiral when you go down that path, I would think.
Yeah, and so many of the adults that we work with were exploited as children. And so they went into the system, and most of them got a mental health diagnosis and a pill. And so that child was marked from that time, whether they were 8 or 10 or 13. And the more encounters they had with the system and with law enforcement, the more they were judged and the more they were labeled as a problem kid or a bad kid. And so, it's a tall hill to be able to create that trust like we were talking about.
I would just like to say, when something like that happens and you get drug off or pushed into something that you didn't want to do, you had no desire to do it, it didn't come from you, there's only so many times somebody can look at you and call you an awful person before you believe it.
That's right.
And then that determines what you do from that point forward in the choices you make.
Exactly.
That's the uphill battle that we're talking about here. We've got Sandy Middleton and Beth Doritos McCord with us. We will. I'm going to get. You need a T-shirt with that. We're going to get you suited up. We got to take care of this. We